Hi everybody, I'm Dr. Wheaton from Alicia Pet Care Center, and today I want to talk to you about chronic vomiting in cats. It's a really common issue that we deal with in veterinary medicine, and y'all are probably dealing with it to some extent as well. It's really, really common. We probably have about a third of the cats that we see have some degree of intermittent vomiting that goes on, and I want to just start off by saying it is absolutely not normal. It is not a regular thing that cats do as a natural part of existence. Every single time that they vomit, it is an abnormal symptom. So that's a really, really important thing that you all need to get in. Make sure that you understand that from the very beginning, because people are going to tell you it's normal for a cat to vomit. But it is not normal. Just because it's relatively common does not make it normal. And we have several examples of how that situation plays out in a really negative way because the owner does not act upon the symptom that they're seeing because they have been told that it's a relatively normal thing for a cat to do. So it is not. I'll carve out a tiny little thing here at the beginning also and give you one of my many sayings. One of my sayings is a hairball is a hairball only if it's a hairball. And so if a cat is vomiting hairballs, it is not really a big concern. It can be a problem for your carpet, but it is not really a health problem for that individual cat. What's happening there is that the cat is grooming as they do, and the kitty is going to develop, some degree of fur that's going to go into their stomach. And that fur might potentially pass through gradually, and you just see a little bit of undigested fur in the fecal material that the cat passes. But occasionally we'll get a cat that really wants to make it into a little wadded ball in the stomach. And the only reason why that fur ball is going to come up and that it is not a vomiting episode is if the fur actually clogs the outflow tract of the stomach. It's very easy to tell this because when the fur ball comes up, it's going to look like a thumb or a dead mouse or a cigar. It's going to be in kind of a tube shape because what's happening there is it's getting, kind of digested or attempted to be digested by the stomach and attempted to be passed, but it forms into this little wad and then it clogs the outflow tract of the stomach. When it clogs the outflow tract of the stomach, it works as a ball valve like your toilet does. It clogs the outflow tract, nothing can get past, and then the cat is doing its just like that. But that is basically what a fur ball is, and they're going to cough up this fur ball, which is actually vomiting it up, and you're going to see the dead mouse or the thumb or the cigar shaped fur ball on the ground. And it may have other things with it, which occasionally that stuff happens, that you'll see a little bit of undigested food or partially digested food or some bile or liquid. But in general, most of the time, it's just a little bit of liquid with the fur ball. That does not count as a vomiting episode, and that is the only thing that doesn't count as a vomiting episode. Every other vomiting episode is vomiting, okay? Whether it is fully digested food, completely undigested food, bile, brown liquid, pink tinged liquid, a small bit of saliva, none of it matters. All of those things just get marked onto the column of a vomiting episode. And if you have a cat that vomits once a year, count your lucky stars. That's not really a big deal. That's not what we're talking about today. We're talking about a cat that's vomiting every 2 to 3 months or more. And if we have a cat that's vomiting once a month, that is our red line at Alicia Pet Care Center of this cat needs to be worked up. This cat needs to be diagnosed with its issue and helped because it is not right. And it signifies that there's an underlying problem there that's causing that vomiting to happen. So nausea is a scale symptom resulting in vomiting at the very high end of the scale. So a 10 out of 10 nausea is going to result in a vomiting episode. A 7 out of 10, you can feed them whatever you really want and they're not going to eat anything because they're so nauseated that they will not eat. A 5 out of 10, they'll eat the fancy stuff. So if you put something new on top of the food, fancy feast or something like that that they don't normally get, that they're kind of interested in, they will probably still eat. And then a 3 out of 10, they'll eat their regular food, but they're not going to eat it with a whole lot of gusto. So that's kind of the scale to keep in mind. The cat that vomits, of course, let's say it vomits, your kitty vomited this morning at 10 o'clock, you can make an assumption that that kitty's probably going to be nauseated before and maybe after that vomiting episode. And so it's just really important that you kind of give a little bit of compassion to that kitty, even though they have to eat. So the fact that they're eating does not mean that they have no nausea, because they won't survive if they don't eat. So there's a really big drive to eat, and just an important thing to kind of get really sort of detective work going at home, so that you don't lose track of the symptoms that we're looking at. Chronic vomiting in cats can be caused by lots of different things. I will talk about some of the more unusual things first, and I'm going to lead towards a discussion that's going to dominate the rest of this conversation about inflammatory bowel disease. But, some off-brand things that we would think about, you could certainly have an obstruction. So if a kitty, is suddenly vomiting, but we're talking about chronic vomiting in this conversation. You could have a foreign object theoretically would cause intermittent vomiting. That's pretty unusual. You can have some anatomic issues, so sliding hiatal hernia, something like that, that's causing kind of a intermittent functional obstruction. You can have some functional issues really also, where the stomach just doesn't work right, or you have thickening of the pylorus, this is the outflow tract of the stomach. These are rare conditions for a cat to have. You can also have tumors of the intestinal tract, tumors of the stomach. Those kind of things potentially would lead to intermittent but chronic ongoing vomiting. It doesn't necessarily escalate with its frequency. It could just keep on going until something more bad happens. We certainly have the majority of our cats vomiting because of primary bowel disease and intestinal disease in general, but we also have some things that can happen outside of the gut that can cause vomiting, like chronic kidney disease, liver disease, hyperthyroidism, severe diabetes, where it's a diabetic ketoacidosis state, various other organic or metabolic concerns that can cause that sort of thing. But again, most of the cats that chronically vomit are going to be vomiting from primary intestinal disease, and that is going to be inflammatory bowel disease the vast majority of the time. Inflammatory bowel disease is a chronic inflammatory condition of the stomach and intestines that is akin to something that's called Crohn's disease in people, which is now starting to be called inflammatory bowel disease as well. But it's a chronic inflammatory condition, so it doesn't go away. It tends to escalate over time. And that can sometimes be triggered by early exposure to a food item that shouldn't be eaten. So we talked briefly about nutrition here with cats. They're strict carnivores. They're supposed to be eating 100% animal 100% of the time. Every single cat on this planet should be eating 100% animal 100% of the time. So if we break that down into categories that help us choose food at the pet store, it's going to be a high water content. So every animal is going to contain basically 70 to 80% water. So you're using a moist diet. Cats are water eaters, so they do much better in this situation. You're also feeding a high animal content food. Ideally, it's 100% to be honest with you, but it should be relatively high animal content. We're gonna have high protein, but that's gonna be coming from animal. And ideally, we want no grain in this diet. So feeding a cat a grain-based diet really is like a cow eating a chicken burger for lunch. There's no cat on this planet that would ever intentionally be eating grain. Grain is a problem for cats' intestines because grain proteins are extremely long molecules. They're very big molecules. In fact, the biggest protein molecule that's ever been discovered on this planet is wheat gluten. But size matters when we're dealing with the gut, because the gut has its own inflammatory system and immune system that's trying to protect us all the time. And that's where a lot of our inflammation happens inside of our bodies, is in our gut. And so when we send something down the gut that's an extremely big molecule, that's a protein molecule, it's likely going to stimulate an attack, because the intestine protection system, the defense mechanism of the intestine through the immune system, is going to recognize that as a potential invader. And they're going to try to attack it. And they're not going to win, obviously, because it's inside of the intestine, it's moving down. But that inflammation is happening at the intestinal lining, and that chronic inflammation of any tissue bed is going to end up with scarring. So then not only do we have chronic inflammation that's distracting the immune system and causing its own effect on motility of the intestine, how fast it moves, potentially causing some diarrhea or nausea associated with that, but it's also causing scarring to the tissue bed if it's happening on a consistent basis, because that's what happens as a result of chronic inflammation, is that you end up getting scarring. So these little tiny brushes that are on the ends of all of the villi, these little amazing cells that go up and down in the intestine, those things will get eaten away by the scarring, and you'll get villi attenuation and a lot of these anatomic changes that can happen in the intestine that just are consequences of long-term inflammation that make it so that it's not as functional as it should be, potentially leading to malabsorption of ingredients that are supposed to be part of the nutrition that the pet is getting, or maldigestion where we're not properly digesting the food item now, and potentially causing us to have soft stool or diarrhea as well. And also, not taking in the nutrients that we need, so that cat is not really thriving because it's not really getting what it's taking in. So that's kind of like the micro level of inflammatory bowel disease, but it does oftentimes get sparked by feeding the wrong food at the very beginning. So going back to that, ideally every single cat on this planet is eating a high moisture diet that is grain-free, that is mostly animal, and you're pretty much not going to go wrong with any cat if you're feeding that kind of diet. Early on is when you want to start that, because you don't want to trigger inflammation and then end up chasing this cycle of inflammation for a long time. So that's basically inflammatory bowel disease on a micro and macro level, as a chronic inflammatory condition that's extremely common in cats, causing ongoing damage to the intestinal tract. With that situation, we have two really common things that can happen with it because of the close attachment to these other organs. One is more common than the other, which is chronic pancreatitis. We also have the potential of having cholangiohepatitis. So the intestine comes down, and there's little tubes that come into the intestine that bring things from other organ systems that are really important in digestion. We have pancreatic enzymes coming through the pancreatic duct that leads to the pancreas, and then we have the gallbladder producing bile from the liver going into the biliary tract that then goes into the common bile duct that dumps into the small intestine. These tubes are really short in a cat, and so frequently when you have inflammation in the intestine, the inflammation will kind of creep up that tube and go into that other organ system. So now we commonly have chronic pancreatitis associated with that kitty. That's really not the primary issue, but it adds to some problems here, can cause extra sources of nausea, some discomfort as well. And then if we get cholangiohepatitis, which is an inflammatory condition of the liver, that can cause additional problems, because then we have a liver that's not happy about things, and potentially alteration of the bile production. And that bile is really important because it goes into the intestine and it helps to digest food. So that is called triaditis. If we get all of those three things inflamed all at the same time, that's what we call it in veterinary medicine. But most of the time, truly, it's not triaditis. The cholangiohepatitis is much less common. Chronic pancreatitis is a very, very common side effect or secondary problem with inflammatory bowel disease. One of the bummer things that can happen with inflammatory bowel disease in cats is that they frequently will mutate their cells that are doing chronic turnover, rapid turnover of these cells because of the inflammation that's happening in there, and we get a transition from inflammatory bowel disease into intestinal lymphoma. Intestinal lymphoma is a relatively common problem in cats as well. Most of the intestinal lymphomas are going to be this storyline where we had a chronic vomiter that now is losing weight. Sometimes they are so bad with their intestinal function that they start to develop diarrhea as well. But if your chronic vomiter starts to lose weight, it's like really time to go to the vet, because that may signify that we have transitioned over to intestinal lymphoma. That's a very treatable condition as long as it's caught early. The treatment is relatively straightforward, honestly, and cats do very, very well with treatment for intestinal lymphoma, unless they have the bad kind. And the bad kind is only about maybe like 3 to 5% of our intestinal lymphoma cases in a cat. That's a large cell lymphoma. It's a totally different storyline. They don't have to be chronic vomiters with this. They just happen to have the wrong kind of lymphoma that happens to them. And that can be determined at the time of biopsy. They'll tell you basically whether it's a small cell or large cell. You want small cell lymphoma. It's a very easy condition to treat typically.
When we got something to say, we go to where the cats play. Come hang with us for a while. We promise to make you smile. Cat Room Chats.